The hip joint consists of two bones and is a simple ball and socket joint. The head, or ball of the thigh bone, fits snugly inside the acetabulum, or cup of the pelvis. A hip is held together by ligaments and supported by muscles and tendons. These and other tissues envelop the hip, creating what is known as the joint capsule. Within the capsule, a type of fluid is produced that keeps the hip lubricated. The ends of the bones in a hip are prevented from rubbing together by a cushioning layer of tissue called articular cartilage. It's this cartilage that allows the bones to move without friction or wear on the bone surfaces. When the cartilage in a hip has deteriorated due to excessive exercise, injuries, or diseases like arthritis, the bones begin to rub directly against each other, causing pain and making movement difficult.
In hip replacement surgery, the damaged parts of your hip are replaced with implants consisting of three components: a socket, ball, and stem. The procedure starts with necessary incisions over the side of your hip. The ball end of your thigh bone is cut and replaced with the new metal ball and stem component. The damaged surface of the socket is smoothed in preparation for the insertion of the new socket. Then the ball and socket are joined. Once the surgeon is satisfied with the fit and function, the incision is closed and covered with dressings.